A very good evening to everyone. This is again our daily press briefing. Friends, I would just like to inform you that a total of 738 samples have been sent for testing, and 667 have come out negative, and total there are 10 active positive cases in the state. We are still waiting about 60 samples. The results are awaited. The condition of all the patients who have tested positive is stable as of now. At the same time, friends, today I would like to just speak a bit on two important issues which I think the people should know, and I think a lot of people are concerned about. One is the protocols for testing, and second is case management protocols for confirmed positive cases. Now, a lot of people have called us and asking us about why they have not been tested in spite of them making calls. Friends, we need to remember that we need to prioritize the testings. Therefore, the protocols are as follows. Number one, the high-risk primary contacts, those who lived in close proximity and contact with the positive patient, are the high-risk primary contacts. The next level will be other symptomatic primary contacts. These are primary contacts who have been in close proximity with the concerned individual. And third are symptomatic high-risk individuals who have visited the concerned hospital after 24th March and have registered with the government. And these are more of individuals who met with the person directly. All asymptomatic cases and asymptomatic individuals who have visited Bethany Hospital after 24th of March 2020 and have registered with the government are not being tested currently. All these individuals, however, have to be mandatorily under home quarantine for at least 14 days. And in case they develop any symptoms, they should immediately call 108 and report. We also, as you're aware, we also had one case from one suburban area of one person who was working in the house of the index patient, and the samples of the 4 high-risk primary contacts and 32 other primary contacts of the person who has tested positive have already been collected. The village community, led by the headman, has decided that all the above contacts will be kept under strict home quarantine in the village with the support of frontline health workers and the community. Apart from that, visits have been made by the health officials and by the block to the concerned village to ensure that they instill confidence in the villagers and the family concerned. The second issue that I would like to discuss with you is regarding the case management protocol. And this is to do specifically with people who are confirmed cases. Number one, all asymptomatic category A and mild symptomatic category B positive patients do not require hospitalization. As per the protocol issued by the Health and Family Welfare Department, they should be under home quarantine, or they can opt to be shifted to a government designated Corona Care Center by calling 108 in case they do not have a space for themselves to self-isolate at home. Friends, the existing evidence shows that about 80% of the positive cases across the world fall in this category. The second are severe and symptomatic cases having respiratory distress, breathing difficulty, and requiring oxygen support. This is called category C, and they would be treated at all the designated hospitals. Number 3 are severe symptomatic cases with other comorbidity conditions and requiring ventilator and ICU support, is category D, would be treated at designated hospitals having such facilities like the Civil Hospital Shillong, Negrims, Dr. H. Gordon Roberts Hospital, Shillong, Supercare, Shillong, and Nazareth Hospital. Therefore, friends, just to clarify to everyone, anybody found positive is not necessarily need to be put in a COVID hospital. As mentioned, 80 to 85% of these people are mild cases with very mild symptoms, and they can be easily treated by simply quarantining themselves either at home or in a corona care center. It is only the cases with category C that require some help, which are basically having some distress and some breathing problems, have to be treated at designated hospitals, and only the severe cases which are having need ICU support are the ones that need to be taken to the COVID hospitals, who will require the manpower. And friends, this is being done throughout the country and throughout the world, and the main reason this is being done is because the management of the patients who are positive is very critical to ensure that all the facilities and infrastructures are used in the best and the most efficient manner. And that is why these protocols have been set, and these are the protocols that we are following as of now. Friends, apart from that, I would just like to also touch on agriculture today. As you're aware that we are allowing agriculture activities in the villages to take place, where strict protocols for social distancing are being asked to be maintained, and most importantly, movement of manpower from across the border of different states is not being allowed. I would like to add out here that this also in agriculture includes products like erica nut, betel leaf, and broomsticks also. So therefore, farmers who are farming in these products will be allowed to transport their products to different markets. But as I said, the restriction of sending it across the district, across the state, will not be allowed, and also entry of traders from outside the state will not be allowed. Therefore, whatever marketing has to be done has to be organized in collaboration with the deputy commissioners so that these restrictions are followed, but the sale and purchase of the betel nut and betel leaf and also the broomsticks will be allowed. Apart from that, there are other aspects also, but I would be happy to take questions if you have.
So the first question, why are all the patients who are infected with the virus not admitted at the COVID hospital?
Yeah, I have already answered this question. The press, of course, has asked this. It's important to understand that the categorization of the patients is important. There is a mild category, which is 80%. Then there are those who are slightly more severe, which is about 15 to 17%. And those who are very severe is about 2 to 3%. It is only the very severe cases, which is category D, that requires special ICU and the COVID hospitals treatment. Most of the cases throughout the world are being treated, which are mild cases, are being treated by simply having to stay at home and quarantining and isolating yourself, and that is the protocol that's being followed throughout the world.
Have the health department zeroed down on the primary career of COVID-19 in Meghalaya?
Friends, this is something that is, of course, a very, very complicated issue. We have, in fact, been looking at all the options, and the assessment, if you look at the entire assessment, it is very complicated. Though we have, gone back and traced all the travel history of individuals, we have also looked at all the patients who have met the index patient, that is the primary first patient that we had. We have mapped those also, and we have looked into all the aspects, and right now we are still examining the entire process, but what is more important right now for us is to see the spread of this virus. We will ensure that we go into the details of that, because that is absolutely important, but I think our efforts and our focus will still now lie more importantly on the spread of the virus. But at the same time, we will continue to move on this. It's a very complicated and very open chapter, but rest assured, we are working and trying our best by ensuring that we look at all the aspects and the possibilities that are there.
Of the two positive cases which has come up today, one is said to be helper, and that helper is in one particular village. Is the patient or the positive case being quarantined in the village, or is it in a COVID hospital? Or
yes, I have clarified this earlier, that the concerned patient who was a helper in the house is from a suburban village, and the person has been in fact in the quarantine and the corona care centers for the past 3 days, and the samples were taken, and of course the sample came out positive. After this was done, the particular individual is in the corona care center, but the family of the individual, after discussing with the family and the village headmen and the local people, they have decided that they will stay in the house. But we have taken the samples of the 4 primary contacts, and at the same time the high risk primary contacts, and at the same time we have also taken samples of 32 other primary contacts who came in touch with the particular individual in the last few days. So that is the status of that patient.
So do the state have adequate PPEs in the state? If not, are we making efforts to buy new PPEs or procure new PPEs in the wake of news that PPEs from China is not up to the standard?
No, I think the PPEs was an issue about 2 weeks, 3 weeks, back, where suddenly the productions had stopped throughout the world. But we are seeing that overall now the supply of PPEs is smoothening out throughout the country and throughout the world. And so therefore, it's not really fully functional, but I think it's far better than what it was some time back. And as of now, we have almost 44,000 PPEs now, compared to yesterday I had mentioned 29,000 or 30,000 odd. So we already in 24 hours have another 15,000, so we have 44,000 now, and we're expecting another 20,000 to come in. We have been contacted by some other charitable institutes and organizations who have also offered to help, and at the same time government is ensuring that more and more procurement is done. We also have a stock of about 15,000 PPEs lying in Meghalaya in Delhi, for which the transportation is being arranged now. So therefore, though PPEs are in high demand and in high requirement, and it's a product that is only one-time use, so therefore it is required in large quantity. But as of now, we should be comfortable when it comes to the PPEs.
So we have learned that today you had a meeting with the state response team in Shillong and also visited the Corona Care Center. So why it was initiated?
Yes, I went to the DHS today, and the entire team of DHS and the task force was there. We had almost a 45-minute meeting, and they showed all the different steps that have been taken. This is being done again to ensure that all the different steps that are required are being taken, and we reviewed the entire situation, and also to boost the morale of our health workers. And I think it's very important at this point in time, when they are really under a lot of pressure and a lot of stress, that we must motivate them, we must support them, and we must let them know that not just the government but the whole state is with them. So therefore it was a review meeting and a meeting to really motivate them. Apart from that, I went to one of the quarantine centers to just check the overall logistics out there, and to see whether the food was reaching on time or not, and the other facilities were okay or not. As you understand, there were some concerns that were raised by some of the people who were there, and it is our job to ensure that we address those issues at the earliest. I'm happy to inform you that the different officials have reacted immediately and responded immediately, and most of the issues in these areas have been resolved. And if there are any other small issues that do crop up, we'll ensure that they are handled and rectified at the earliest.
Thank you, sir.